committee of the whole meeting. I'll begin. I'm Jay Brennan, councillor, and I'm the chair tonight. I'll begin with our land acknowledgement. On January 10th, 2022, we acknowledge that this sacred land on which Smith Falls is now located has been a site of human activity for over 10,000 years and is rich in Indigenous history. This land is the ancestral and unceded territory of the Algonquin Anishinaabe Nation. We're grateful to our Algonquin ancestors who cared for the land and water in order that we may meet here today. We are also grateful to the Algonquin people for their contribution in making of the Rideau Canal, which runs through Smith Falls. We are mindful of broken covenants and the need to reconcile with all our relations. Together, may we care for this land and each other, and drawing on the strength of our mutual history of nation building through peace, friendship, and being mindful of generations to come. So I'd also like to add a Happy New Year to everyone. And I think that this is going to be a great year. And I want to compliment not only my colleagues, but staff as well, because we've been moving forward at a great pace throughout this pandemic, and more good things are to come, I know. So I'll begin with amendments to the agenda. Seeing none. Any disclosure of monetary interest arising from the agenda? None. So we have tonight 4 delegations, 3 of which are related to our community donations. The first one is not, but it's an exciting proposal that we're going to hear from in a couple of minutes. And we all know Michelle Bellows from Rideau Community Health Services. And Michelle, I'm excited to hear what you've got to say, and for the people to hear what you've got to say. So I'll turn it over to you, Michelle.
Thanks so much, Councillor Brennan. And it's a pleasure to be here. I am just going to screen share, and then if folks can tell me if you can see that, that'd be great. A nod. Perfect, thank you. So thanks to everybody for giving us the opportunity this evening. So Rideau Community Health Services and our partners have been working now for close to 5 years on a vision for a health and community hub. And that's what I'm going to speak to you tonight about. So some of you do know me, absolutely. I'm Michelle Bellows. I've been in healthcare for more than 30 years. Some of you will know me from my more than 10 years at the Smith Falls Hospital. And now I'm the CEO at Rideau Community Health Services, where I've been for the last 3 years. So our Health and Community Hub is really for the community and for the town of Smith Falls. And it is exciting, Jay. I think that was wonderful the way you introduced it. It is a really exciting opportunity, and we're excited to be able to share it with you. So just a little bit about who we are. So we're a non-for-profit, community governed health and social service agency. Some of you may be our clients. We offer programs and services across Lanark, Leeds, and Grenville. We have regional programs that serve all of LLG, including a diabetes program and a telemedicine program. We have some new Ontario Health Team funded programs, which are really exciting, which are increasing access to clients to our programs and services. And we also offer a plenitude of programs and services, as you can see here. And most excitingly, we've actually grown significantly in the last 5 years and almost truly doubled in size in less than the last 10 years. And we serve more than 10,000 people in our communities. So we're here, and we're excited really to serve the community. So the vision, so what is it we hope to do? So our goal, and I do have a list of partners, and you'll be able to see everybody who's been engaging with us and working with us. So we create a community and health hub in Smith Falls, 30 to 40,000 square feet. That's our vision. It can change absolutely depending on what's going on, but that would be what we'd like to see. And it really will be having all the agencies come together with the community to help co-design and create a space that's both welcoming and enables sharing of programs and services. We want to improve the client's experience. So people who come to this hub should have a positive experience. And we want to improve people's health and well-being, but making sure that we're providing client-centered care. So coordinated care. So imagine a space where you can see your primary care practitioner, one of the physicians or nurse practitioners, and they want you to go and see somebody about community home support. We hope to have them in the building with us, and they can send somebody down and meet with you immediately. If you know somebody who could benefit from Meals on Wheels, if you know somebody who potentially has a person with a diagnosis of Alzheimer's, we'll have that agency as well as partners with us. We'll be able to have interprofessional collaboration. So that's pulling a multitude of partners together to be able to have conversations and to better support our community. And I think probably one of the most challenging parts of our health system is transitions of care. So that is really how we'll try to improve and make it seamless to enable better supports. And that supports a lot of the work that we're continuing to do. And I think really when we think about a community, it really should be about making sure we have equity of services to everybody and to also improve navigation for clients. So you may be in the health system, but perhaps you don't know what to do next. And many of us are in that. In our 30 years, I reach out and say, who should I connect with? So that would be one of our goals as well. So when we talk about the project itself, it's a $10 to $15 million project. We have submitted a capital investment branch application, and it has been, so we've had COVID in the middle of us passing in our application, and we continue to touch base with them. And Capital Branch has the information they require. We know that obviously the past 2 years, and yes, believe it or not, it's been just about 2 years, there have been other priorities that continue to rise to the top, and that's of course COVID-19. So we began again a rejuvenation of our project in the fall and began meeting with the Ministry of Health and other ministries to really highlight who we are and what we wanted to achieve. We want to also enable a community space. So that may be a community kitchen, that potentially a community kitchen, which RCHS already has. So we'd like to continue with that. It could also involve a community space, potential recreational space. We currently have space where we hold regional yoga programs. Yes, we do yoga programs virtually, which is wonderful. And as well, potentially a community garden and an outdoor space as well. So we see a vision, and it's really about how we can have our vision come to fruition. So we know the benefits when we have partners coming together. It really is about stabilizing fixed costs for our non-for-profit partners. We know costs increase yearly, and our actual dollars that were provided by the ministry do not. There would obviously be the economic and social benefits to the Smiths Falls area for a $10 to $15 million build. We believe that by pulling people together and working with our communities, we will strengthen the communities. We will develop programs and services, and we will involve the client, the community, and families. The idea of a welcoming and safe space for youth and adults, and that supporting mental health is also key. We want to provide indoor spaces that are available for the community. We have them, and we want to continue having them and making them available. So as I'd said, it includes a community kitchen, potential community gardens, outdoor community space, indoor recreational, and potentially outdoor recreational space. And we do see benefits for clients. You get to come to one place and see many providers potentially, reducing your own travel time and reducing your time period. And that improves both the client experience and it improves actually all the providers' experience because they know they're being able to access programs as we move forward. And once they've met with you, they know that we're actually being able to pull people together with us. So our partner agencies are diverse. It crosses the continuum of both health and social services. We have the LLG Alzheimer's Society, mental health and addictions, including child mental health and addictions with open doors for children and youth mental health, community home support, the Smith Falls Nurse Practitioner-led clinic, Connect Well Community Health, and Rideau Community Health Services. So these are partners that have embraced the idea and have been continuing to meet with us for the last 5 years. And we've re-engaged and they still have a commitment to working with us. And it crosses the spectrum of services as well as provision of services across an age group as well. And of course, there's always a potential for more partners when you go out and you formally ask. It's amazing the partnerships that you may find. So for us at Rideau Community Health Services and our partners, we understand that following a community consultation that happened in the summer of 2021, there may be an opportunity for discussion around the land located in the Highland Corbett Park area. And what we are looking for today is we're seeking council support to work with municipal staff as well as Rideau Community Health staff into investigating further the opportunity and potentially developing a report for the town council and RCHS's board's consideration. So it really is about how we can work, potentially work together and see what opportunities are available for the development of this space. So thank you so much for the opportunity and I'm open for questions.
Okay, thanks, Michelle. I would just put the screen off there and then we'll I'll see everybody, see who's got their questions for you. So I'll open it up for Councillor Allen.
Yes, thank you very much. This is a great idea. I don't think it's one that we haven't been aware of, but it's certainly one that I think is going to be wonderful. I just wonder, Michelle, if you have given any thought or have spaces in mind. Like, have you done any preliminary kind of looking at different areas or?
For sure. So actually, we've looked at spaces for the last number of years. And of course, we see spaces come and we see spaces go. And one of the biggest challenges is that we're working with the Ministry of Health, the capital branch, to enable us to fund the land, obviously, as well as the building. So there's a grant that is sort of step one with when you're dealing with capital branch. So we absolutely are open. We recognize there is possible other opportunities. Today, we're looking at specifically the land surrounding the Highland Corbett Park area that the town did a community consultation with. And we're wondering if there's an opportunity for us to explore that further with the town as an opportunity for the health and community health.
Okay. I have Councillor Alford and then the mayor and then Councillor McKenna.
Thanks, Michelle. Good to see you again.
Hi.
Appreciate you coming tonight. And this is something that has been long discussed, bringing all these services into one place. And I did have a question with regard to the indoor space, namely the community kitchen. A little later, we're going to hear about a community food hub from Ramsay Hart. And I'm wondering, is there a potential for, in the long term, for a community food hub in this space as well? Is that something that you've considered?
Thanks so much, Wendy. So there absolutely is an opportunity, and it really depends on the size and what the space looks like that we can get built. So the space that we're looking at for the food hub is a relatively large space with a large sort of communal dining area. So it really is about how big that has to be and what that looks like, but there's nothing that precludes us from having a relationship and a partnership, which we currently actually have with the table, and continuing to explore what that can look like in the future. Absolutely.
Okay, thank you, Michelle.
Okay, Your Worship.
Yeah, thanks, Michelle. And obviously this makes, as Councilor Brennan said, a very exciting opportunity, but I think where it's most meaningful is what it would, the benefit it would bring to the people of our community, and probably the broader community as well, right? And the ability to bring these services together. Can you just talk a little bit about the journey over the last 5 years? And I can appreciate the challenges in bringing this type of project to reality. And I think probably widespread support to bring it to reality. But I guess, as you mentioned briefly with Councillor Allen's question, the availability of land and the fact that you'd considered other locations before, and those properties have since been purchased and developed or under development or will be developed. I guess as we all know, if we look across our community, there aren't a lot of properties that would accommodate a 30 to 40,000 square foot building. And understanding intensification and going up probably makes sense from a municipal standpoint to make good land use. But can you speak a little bit about your journey thus far, and how important is it for you to sort of secure a piece of land when it comes to discussions with the province for greater funding opportunities?
Absolutely. So if I'm getting long-winded, please wave or something. That would be great, because I recognize you have a pretty full agenda this evening. So RCHS, we've been working towards this since 2017. So this is now our 5th year. And Councillor McKenna was the CEO at RCHS at that time. So he would be well aware of the beginnings of this project. And we continue to meet with the Ministry of Health and working with the Capital Branch with the ministry. And we continue to do that. And when I came in 2019, we again went to Toronto. We met with several ministries over 2 days. And we've done that 3 times since I've been here, which has been fantastic. And some of it has obviously been virtual now, considering where we've been the last 2 years. And during that time, there's been an election, which work sort of had to stop. And as well, COVID came in sort of February, March of 2020. So we started our journey. We did do a site review, looking at what was available in the town. Some of those sites are no longer available. Some of them are already being or in the process of being redeveloped. And even with the project that Ramsey Hart is going to speak to you later, when we're looking for space, and Ramsey's done a pretty in-depth look at the space that would be potentially available for redevelopment, there's not a huge number that would sort of check the boxes if you were trying to redevelop a space that would house a 30 to 40,000 square foot building. And vacant land, we've certainly kept in contact with the real estate agents and communicating with the town to try and understand what opportunities are potentially out there. Of course, with the increased growth of canopy coming, we see land going on the market and being snapped up pretty quickly, and we see costs increasing exponentially as well. Great for the community for sure, but for us, it really becomes sort of a let's see what we can do and how we can move our project forward. So it's been a journey. It continues to be a journey, and we continue to meet with the ministry, and we'll meet with our MPP hopefully in the coming weeks to make sure that our project remains top of mind on top of COVID-19. But it's really important for us to make sure that it stays alive. And it is a vision. It really is. And we did speak to the benefits to the community. It would be so exciting when you think of how we can serve a community together and have people come together. I've been lucky enough to visit a couple of hubs, and it is so exciting to see the vibrancy within them and the services that they provide and the diversity of community that comes to a hub. it's really pretty awesome. I hope that helped.
Yeah, well, thanks, Michelle. And I'm certainly supportive of, I think the next step, which would be having staff interact with yourself and your team to more define the specifics around what your needs are and how this could benefit the community and that whole picture. Thank you.
Thank you.
Yeah, I think Councillor McKenna had a comment.
Thank you, Mr. Chair. And again, nice to see you, Michelle, and welcome. And I'm thrilled to see the dream is alive and well, and I hope it doesn't fade until it's actually a reality. I guess I just want to reinforce your message about recreation being part of health, and it's a huge part. The doctors and hospitals are critical, but indoor recreation space, green space is also a big part of our health. And I know you didn't have time to really get into it, but the taxpayers are supporting all these agencies with rent dollars, and millions of dollars are going into rent when those dollars could be going into services if we actually own a building. And I think there's good value in pursuing this. And I think it would be a jewel in our municipality to have an enterprise of this scope, which would be a regional service located in the heart of our community. And I too would support your ask of asking our staff to work with you to come back with a report to council about the feasibility and viability of a potential land that we might have available to support this initiative. So thank you.
Thank you, Councillor McKenna. And it is lovely to see the vision still alive and well.
I think Councillor McGuire had his hand up there. Did I catch that, Chris?
Yeah, thanks, Mr. Chair. Thanks a lot, Michelle. This is amazing. It's so exciting. It's a completely new idea that people have been talking about before, but to have a presentation to council is awesome. I'm wondering, there's 2 parcels of land there separated by Sussex Street. Is the vision at this time to incorporate those into one parcel, where we'll see this full range from recreation to health to everything, or is it to occupy one of the 2 parcels, or is it too soon to comment on that?
So thanks for the question. So I think it's too soon, but I believe that could be the work that we would do together to determine how we can actually ensure that we have green space, potential community gardens, a community and health hub, as well as be able to build a space that would be and meet the needs of the community and our partners. So I'm sure all of you are aware of the space, and it's a beautiful space. It's in an area of town that would be wonderfully served by the community and health hub, absolutely. And I think it's really about how we can work with town staff to see what that vision could look like and what that space could truly look like if we closed our eyes and dreamt and then opened it and we were able to see something like that. Would be pretty fantastic.
Awesome. And if it brings another deep pave project, even better. So thank you very much.
Perfect.
Any other comments? Seeing none, I'm going to thank you, Michelle, for coming. I too support us working with your group, and when you talk about getting the province behind it, that really piques me, because I think when you're talking about a $10 to $15 million project, I think the province should see the value in that, and so it's going to benefit our community. If our town is behind it, then that'll help hopefully get them going as well. So thanks so much for coming, and I think I've got consensus that we want to work with you in the future. Thumbs up all around there.
Thank you so much again. Thanks for the opportunity, and I'm going to go into the non-live stream feed now and follow the rest of the meeting.
Okay. Thanks, Michelle. So we have now we have 3 additional delegations. These are all related to community donation requests, and I understand that next week staff will be bringing forward a full report on these requests, in addition to the ones, I think there's a total of 12. We're hearing these 3 because they exceed, I think, $10,000. And so we want to hear for the bigger ones. And then next week, we'll be talking about the whole package. So committee, please ask all the questions you want. And then next week, we'll have a talk about where the money will be allocated. And so the first presentation tonight is Sandra Borelli from our friends at Big Brothers and Big Sisters of Lanark County. And I want to welcome you, Sandra. Good to see you again. And the floor is yours.
Thank you for having us again. So I am Sandra. I'm the executive director with Big Brothers Big Sisters of Lanark County. And just a little bit of the background. Back in 2017, the town approached our agency because there was a need for continued youth drop-in services. And so we came together and built an idea. And so WAC was born, the We Are Kids program that we deliver to this day through the, or rather out of the youth arena in Smiths Falls. And so we do that in addition to the other programs that we as a Big Brothers Big Sisters agency provide, similar to all the other programs that are nationally known and recognized. And so this year, as in last year, we are coming forward and asking for continued support to run WAC, to continue doing the things that we're doing and some other things. So again, we are asking for $25,000 this year to support kids by giving them a safe place to go to after school, either virtually or in person as the circumstances allow. Our objective is to support and stimulate mind, body growth, communication, team building, those pieces that are really integral to developing as a youth. I think what I wanted to add this year in particular is that as you consider our place in the community and in the community's town budget, what we're doing now has dramatically changed since March 2020. I don't think that would surprise anybody to hear that. And so I wanted to give a little bit of insight as to where the resources from last year went. Because it would be simply misleading for us to say that we're asking for the same to do the same, because we're not doing the same. Our frame of reference really has completely changed. So as many of you are aware, I'm sure, this year our community lost a beloved young person. And this was a youth that held WAC program in really high regard and whom we enjoyed tremendously coming to our program. And we realized that as the isolation and the disconnect grew during the first wave of the COVID-19 pandemic, many Canadians have suffered, and we're seeing the statistics now, they're continuing to suffer, and the stats are really astronomical and scary. And shortly after we lost this youth, I met his mother outside of our own building, outside, and she handed me a little envelope. And in this envelope was this youth's allowance. He had been collecting it because he wanted us to have it. And in that moment, I think is really, if I could encapsulate when it all changed for us, it was really in that moment, because we realized there and then that we needed to keep doing what we're doing, but we needed to do more. And so right there and then, it really shifted the lens that we're working from at the WAC program. Because not only do we need to keep doing what we're doing in terms of in-person and connecting online, be it what it is we're doing that week, we needed to continue to be in touch with our kids, regardless of what the situation at hand was. And so we initiated what we refer to as the Touchpoint Program, in part born out of the fact that we were closed to programming 48% of our potential open days this year. And so how could we stay in touch with all those kids, past and present, regardless of the situation? So we started making phone calls. So in 2021, we made 1,226 Touchpoint phone calls. We called every kid, past and present, that we worked with, and all we said were things like, how are you doing? What are you doing? What do you need? Is everything okay? And we formed, well, we've always had very important connections with other community partners in order to deliver services, but this year was really and truly exceptional. Because out of all of those phone calls that we then made 471 porch drops. We dropped food. We dropped food baskets. We dropped gift certificates, boots, coats, sports equipment, 13 deliveries that are all of different kinds, because we learned specifically what our kids needed. And so that's really the kind of thing that we have added to what we're doing as a WAC program. It's unconventional, but it's what was needed. And so that's where we went with that. And we did that, of course, in addition to running all of our other Big Brothers Big Sisters programs, either virtually or in person, as allowed. But what you really can't quantify with the numbers, these big numbers, and number of calls and number of porch visits, is really the pieces that we discovered through these touchpoint calls. For example, one youth who we had been alerted by an external party that this youth may have been in trouble. So we pulled out all the resources to try and find this youth, and we could not. And then when we finally did, we learned that there was some really dire need for immediate food, bedding, a bed, as a matter of fact, and transportation to school. And this was a youth that, would have fallen off of our radar had it not been for this Touchpoint program and this process that we put in place. And in so doing, we did manage to find the youth, and we managed to pull together other service providers who had been working with them in order to make sure that everything kind of came together. And so really that's the work that's come out of that. And another example is a touch point where one of our caseworkers visited a family on their front porch and learned in early December that despite the fact that both parents had full-time jobs, they could not afford Christmas presents this year. So we delivered 11 Christmas presents. So it's really become a different kind of approach. What we're doing with our youth right now isn't just the WAC, drop-in program as we've known it in the past. It's really trying to kind of bubble our community and say who's where and are they okay. So essentially this year we're asking for the continued support of $25,000 from the town to continue doing what we're doing and to continue these important touch point calls. I think, if I had one wish for 2022, it's that we don't miss any kids. So that's where we are. Thank you.
Thanks so much, Sandra. And I'll open it up to my colleagues for questions or comments. Councillor McKenna.
Thank you, Mr. Chair. Thank you very much, Sandra. Coincidentally, it's 1 year today since we lost that young man. And I would have before we lost him, and I will continue to support your efforts and your partners' efforts. And I congratulate you on the work you're doing, and keep hope. We will get through this with our youth intact, I hope. And so I'll do everything I can to continue to support you and the work you're doing.
Thank you.
Thank you for that. Mayor Peko.
Yeah, thanks, Sandra. And of course, we have WAC because Big Brothers Big Sisters stepped up, as Sandra mentioned, 4.5 years ago to ensure that youth services continue in our community. And I was a big fan before, and your comments today, Sandra, I'm a bigger fan now. I mean, you guys recognize needs. You executed a plan to reach out when kids couldn't reach out to you, and to make sure that these youth have the support that they need. And there's no question it makes a difference. And I think like $25,000 is the ask, and obviously it'll come back to council I think next week or the week after, but fully support your organization, what you're doing. And I can't help but think with Michelle's presentation earlier, maybe some synergies there as well. I'm sure you two will be talking, but
we've already spoken, yes.
Okay, so thanks for all the great work that you and your team are doing. Please keep it going, and hopefully we're through this pandemic at some point in time where you can expand what your services are providing to our town. But outstanding job. Thank you.
Thank you. Thank you.
Any other comments? I'll just say that, Sandra, I'm happy to personally support Big Brothers and Big Sisters every year. And you really stepped up to the plate when our youth center closed. And, thank you very much. And I look forward to speaking about this more next week.
Great. Thank you, everyone.
Thanks for coming. Thank you. Okay. Next on the agenda is Mr. Ramsey Hart from the Table Community Food Center. And I've never met you, Ramsey, but happy to see you. And I look forward to your presentation.
Good evening, everyone. Thank you very much for the invitation to speak with you. Thanks to Nadine for all the reminders and help with connecting to the meeting tonight. She's made it very easy to do so. So I just want to take a few minutes to introduce you to the table and a project we're working on with a number of folks in Smiths Falls. I've been the executive director at the table since 2014, and I'm really excited about this opportunity. It would really be the table's. We've grown over the years and we've expanded and adapted our programs. This would be a major, a real first major expansion of our operations into a new community. So tonight I just want to give you a bit of a background on us, the origins of this project, our vision for the project, who's involved, where we're at, and where we hope to go. The table is a community food center, and community food centers exist across Canada as a relatively new, sort of in the last decade or so, response to the connected challenges of poverty and food insecurity and social isolation and community engagement. When I first did this slide, I had this top statistic, and it was pointed out to me that around 10% of the population being moderately to severely food insecure probably grossly underrepresents the number of folks that actually are challenged to meet their dietary requirements. And if you look at the health unit's data and infographic that they put out on food security, it certainly shows that anybody that is living on social assistance, anybody that's making minimum wage, if they're paying market rents, and they're probably challenged to afford sufficient, adequate, healthy food in their diets. And we know in Smiths Falls, 30% of the population is low income, and probably 30% of that means 30% of the population rather than 10 is dealing with some degree of food insecurity. We also have the situation where increasingly people are isolated, and they may be living alone, or they may be just not connected to this in the same way to community organizations or groups that they used to be. And some have likened the loneliness issues as being equivalent to smoking a pack of cigarettes a day. So community food centers are a response to both of these issues. And what we do is we create dynamic community spaces where we bring people together to share food. The food is high quality. It's focused on fresh, from scratch, nutritious, and delivered and provided to folks with a lot of respect. We also work on improving people's skills, so connecting them with resources to improve whether it's gardening or healthy eating or cooking skills. We take a health lens and a health equity lens, trying to make sure that programs are responding to people's health needs, and recognizing that food, we talked about recreation earlier in the meeting, and certainly I agree with that being a core part of health, but also point out that food is an essential part of everyone's health as well. We really strive to make sure that everyone that's engaged in our centers, to their choice and to their ability, has opportunities to participate and be involved and to take leadership and to work with others to collectively and individually improve their situations. So what we're trying to do is reverse or turn up a little bit the idea that there are those that are empowered to give and those that are needy and aren't going to receive a charitable handout or food from us. It's really about the community coming together, collaborating and working to resolve these challenging issues. Our spaces are welcoming, they're bright, they're beautiful. They're places where anyone in the community would want to go and spend some time. We also recognize the limitations of this kind of support and want to work on systemic change and involve people in political processes and lobbying and trying to create change locally and also provincially and nationally. There are now 15 community food centers spread across Canada, almost coast to coast to coast. We don't quite have one right on the West Coast, but we've got a couple in interior BC, so we're getting closer. And they're in very different kinds of communities. And here in Perth, we're very proud to have been one of the first community food centers to be developed outside of Toronto. Just to give you an idea of the kind of things we do at the table and the kinds of things we hope to bring to Smiths Falls, not to say that we're going to carbon copy or cut and paste what we do in Perth. We want to recognize what's already happening in Smiths Falls and adapt our programming to the reality of Smiths Falls. But in Perth in 2021, recognizing this is a very different kind of year, being still in the throes of the pandemic, these are the programs we ran. variety of community garden programs. Our two biggest programs are our community meals, which we do 3 times a week, and our food bank, which operates 4 times a week. We have a fresh food box program. We had a kids kits program, which was a take-home program. We did 15 families in Perth and 15 in Smiths Falls. We have a social justice club, a peer advocacy office. We worked on the town of first official plan review, and we ran a youth garden program in Balderson. Ordinarily, there would be an equally long list of other programs that we would offer, but during the pandemic, we're limited in what we can be doing. Our experience and the experience of the other community food centers across Canada, as well as increasingly sort of academic research, is showing the value of these kinds of centers, which bring people together and offer a variety of programs. Much like the food hub or the health hub concept that Michelle was speaking to, the more you can locate different kinds of services and programs together, the more beneficial. You can cross-refer people. You can just meet a variety of needs, and people don't have to feel like they're getting shuffled around town to address their concerns. Also, different people have different ways of accessing the programs, and different things will bring them into the center. It was really interesting to see an academic study where the Ottawa Food Bank paired up with University of Ottawa and did a research on what impacted food security for folks living in Ottawa. And it was really the centers and facilities that ran a variety of these kinds of programs and didn't just do one sort of thing that you saw an impact on food security. Though limited, we got to acknowledge that addressing food insecurity is a bigger issue, but where you saw a difference, it was really in those locations where they had multiple programs being offered. People also tell us that our programs work, and they tell us that we're an important part of their food strategy, and they tell us that they feel like they belong in a community, that coming to the table, even during a pandemic when their opportunity to socialize is really limited, it still makes them feel like they're connected to something. And they provide us with a wonderful feedback like this, where someone told us that the table has worked wonders delivering love with a meal. So we recognize and want to shout out to everyone doing awesome work in Smiths Falls to address food insecurity and social isolation. And we are collaborating actively with the groups that are currently running programs. So this is not about duplicating services. It's not about us coming in and saying, we know what's best and we're going to take over this situation. It's a collaboration, and it's based on an invitation really from many of these groups for us to level up a little bit and provide a bit of coordination and support. And so I'm not going to go through all those. You probably know all of that these are all running already and doing a great job. But there is, sort of a sense from folks that we've been working with that there is something missing, that we've got many programs spread across town, and it would be great to have a centralized primary point of contact for these programs. That there's concerns about the sustainability of the meal programs. A few of them run basically on the goodwill, energy, and commitment of a single volunteer. And if that volunteer is not available, then the whole program is put at risk. They come and go based on funding that's available. And so having a more robust fundraising strategy to ensure that there's resources to keep programs going. Making sure there's space when we can do it, hopefully soon, for people to actually come together around food and be together is needed. Also a space where people can go and drop in and get out of the cold, or grab a coffee, or get online and check the internet. And maybe they happen to encounter a social worker or someone that can help them do their income tax while they're there. And also the advocacy effort and the work of bringing the community together and really championing a change around these issues. So this is a quote from somebody that has become involved with our group and is on our steering committee. They are familiar with the concept of a food center or a food hub, and as they were involved with one of the other early adopters of the model in Stratford. It's called The Local. And Stephanie has told us that Smiths Falls needs a welcoming place, non-judgmental space, a center for all to learn together, a place where you don't feel like you're being shuffled off to someone else and are forced to fend for yourself, a place that works with individuals and teaches them that can all make our community stronger. So we've worked together to craft a bit of a vision, and it's very much a working draft, a living green document, if you will. where we're collaborating to create a new community space in Smiths Falls. And the first priority is to provide access through nourishing food to community members in the form of meals. But it will do much more than that. It'll be a place to provide opportunities to learn, socialize, engage, and connect with other services and supports. It will be an inclusive and safe as possible for people of diverse gender identities, races, religions, and backgrounds. What does this actually look like in concrete terms? It's a space with a commercial kitchen that meets all health and safety requirements. There's ample food storage areas, a large multi-purpose area that can be a dining room or maybe an exercise room or maybe an after-school program area, but something that's flexible but really enables us to set up and feed 60 to 100 people at a go, probably, maybe even more. We also would want some private meeting space so that folks can go and have a consultation with somebody, and also, perhaps an office or two for staff. We've been working over the last few months with Michelle, who you heard from earlier at Rideau Community Health Services. The mayor has been very actively involved, as have some other councillors. And shout out to Councillor Alford, who brought her brothers out to help us move a bunch of equipment that we salvaged from a restaurant that had gone out of business and would have otherwise been thrown out. But on the ongoing basis, the mayor has decided to be part of our steering committee. We also have Laura Merkley from Society of St. Vincent de Paul's, Catherine Aska from St. John's Anglican Church, Reverend Christopher Ryan from Trinity, Paula Kerr, and Stephanie Cates as community members. And as I mentioned earlier, we've been actively engaging and speaking with organizations in town that are providing food services, but also other kinds of community programs like the Adult Learning Training Center. My board of directors has given me sort of a yellow light to proceed on the assumption that if we can have a proof of concept and viability, that this project could be run as a program of the table, saving the need to set up a whole new independent organization and creating a new board of directors and new bylaws and all that kind of stuff. If at some point it's deemed that that's what's needed and we want to butt off and create a new organization, that would be fine. But for the short term, the vision is to have it run as a program at the table. We are thrilled to receive $50,000 in support from Canopy to go towards ongoing food programs and the development of this new space. And we've got active live applications in with Public Health Agency of Canada and the town of Smiths Falls. And later this next few months, we'll be launching a public appeal for pledges of support. So the ground is being prepared, it's being worked. We've got a lot of fertile soil to plant these ideas into, and we're hopeful that it'll bring forth some really great results in the months ahead. We're working on formalizing our steering committee. We have a communications plan that's just getting started on developing that. And the point of that will be to socialize the concept and document support, both financial, in-kind, and volunteers that will be necessary for us at the table to really feel confident that we could sign a lease for a property or invest some of our resources further into this initiative. We want to work with the community to refine the model and prioritize what kind of programming and when and what exactly the programming will look like. And we need to find a location. We've got a few in mind that we're exploring and looking at, what would be needed to have them meet the requirements. And then, of course, in addition to individual and local businesses, we'll be seeking out grants and other financial supports. So thank you for your time. The ask that we have in front of you is for both some of the initial startup costs as well as ongoing costs, totaling $40,000. And it's all detailed in the budget in the application. But I'd be happy to speak to the specifics of that or any other questions you may have.
Thanks, Ramsey. If we could turn the screen off, I'll see everybody and get the questions going. Councillor Alford, you got your hand up?
I do. Thank you, Mr. Chair. Not so much questions for Mr. Hart because I'm quite familiar with this. We've attended meetings together, and so I've seen this evolve, and I'm very excited to have Ramsey here tonight to talk about this. The Ottawa study made I agree with much of what they said. Food security is primarily driven by a lack of income. And to see significant reduction in food insecurity, we will have to recognize the need for systemic change to support people with a dignified, compassionate, multi-service approach. And Mr. Hart is here giving us a roadmap to be able to have that in Smiths Falls. Some individuals in this meeting have had firsthand experience in answering cries for help in the last couple of years. And our faith-based community has responded to those same cries with lunch programs, but none of that is sustainable in the long term, and poverty will always be with us. So to understand, for those watching, for those understanding a call to action for them, you have to understand where we are today. The current model we have in place here allows for people to line up once a month for a standard food package based on family size during 4 2-hour windows a week. Now, a mom with preschool age children, that's hard to do. If you're a young man who's working, that's hard to do. If you don't own a vehicle, your choice is to walk if you can, or pay for a taxi, or find someone to help you get there and back. And for several months a year, this is made even more difficult with our weather conditions. It's either boiling hot or freezing cold. Smiths Falls, we can do better. Our disadvantaged residents deserve better. And the people of Smiths Falls have proven over and over and over how caring they are. With their support, a community food hub is the way we can have better. So I am so supportive. I'd like to jump out of this chair and run to Ramsey. But in the meantime, that is my hope and my wish that this gets off the ground as quickly as possible. And I have full faith in the people of Smiths Falls, because they've so often proven what they're capable of doing when they see the need. So thank you very much, Ramsey, for coming tonight. I'm very glad to finally have you here.
Okay, thank you for that. Anybody else? Councillor Dwyer.
Thank you. Ramsey, thank you so much for coming. I think this was a really informative presentation, and I think it really highlighted some of the unseen work that you guys are already doing in Perth. I didn't realize quite the scope of services that that the table was providing, and it sounds like this was a pared back scope. So I'm sure next year will be a banger year for you guys once COVID's no longer being discussed. I think if this is something that can generate organic support within the community, then fantastic. I don't think programs like this work in a top-down imposed model, but I think you acknowledged that yourself, and you said, you know, you're here because you were invited by a group of concerned citizens who are seeing struggles within our current established framework of service providers, and this is a way to kind of build more consistency in that network. And I think that's so important to building some legitimacy and sustainability to those services. And I'm so glad to hear how well this program is going to twin with what Sandra was talking about WAC doing and what Michelle was talking about in creating a community hub anyways. Like, I think the time is right to be having this conversation. I think the ask of the municipality is reasonable and nominal, and I'd be happy to support that. I mean, we can get into the debate when the debate occurs, but I think it's reasonable. I really, really do hope that you will circle back to us after you start to seek pledges and support from the community, because I really would like to see kind of what sort of support you're getting from there. I don't think that the services that are being offered fit everybody's expectations for using a service like this, but I think that said, it has the capacity to reach people that our services are not currently reaching, and perhaps over the long term, more and more people will get on board with participating in a social justice centered program like what's being offered. So I think that's really positive. My only question is, when you start looking at how you're going to roll this program out, I mean, you've pared down the view of service offerings initially. Are you looking initially at creating some like capital investment in space, or are you simply looking for kind of a turnkey walk-in ready facility that you could rent in the meantime to kind of assess what your success rate is going to be in town? Like, I'm just wondering how you see like scaling this program locally.
Great question, and your comments make me feel like I got my point across. So thank you for that. It's always I take every opportunity I have to talk about the table, because even in Perth, though we've been operating for 10 years, people are just like, wow, you guys do all of that? And so, yes, we do a lot. And some people still are learning about that. So it's great. So the current concept is we're looking at possible rental arrangements in town. We haven't found any place that's a turnkey option that would be like ready to go. So there is we are anticipating some significant capital costs to set up a kitchen at the very least, and perhaps fix things up around meeting codes for bathrooms and things like that. If there is out there somewhere with a commercial kitchen and a dining hall that could fit the capacity we're looking for that I haven't been made aware of, I'd love to hear about it as soon as possible. So it's kind of a middle ground, not building something from scratch, but taking an existing space and outfitting it for our needs. So that's kind of the model we followed here in Perth, where though we did purchase a building, royal we, I wasn't involved at the time, but a building was purchased. We haven't seen anything that's on the market that would be anywhere close to affordable. So we are looking at some sort of a rental arrangement. And who knows down the road, you know, Councillor Alford mentioned the concept of a food hub in the health hub, which makes a lot of sense. And many of our partner organizations across Canada are co-located with health centers. So that down the road, but the sort of message I've gotten is that is a ways down the road, and we want to see the food hub up and running sooner than that could. And we could, I think, see a food hub in the within the year up and running easily, I say, but you know, much more expediently than the whole $15 million building it from the ground up. So, you know, we want to get up and operating, and then if the health hub gets operating and there's room for us, then great. We'll address that later on.
Thank you. And Mr. Chair, just one follow-up question. Ramsey, when you're looking for a space, are you looking for something that would give you pretty much principal tenancy, or are you looking for the potential of a shared space where you may be using it for certain hours or days a week, but then it also has another user who would be renting it as well? I wonder if that flexibility might be helpful in finding you some co-tenancy with somebody who already has a commercial kitchen.
Yeah.
I don't know.
We would be open to it as long as it wasn't really restrictive and that there was a compatible co-use. So the co-users would have to sort of be, I guess compatible is all I would say. And that we would have pretty open access to time of using it. And it wouldn't be like, okay, you can have Monday nights. That's, we would want to have like a lot of the time in a week. If somebody was using it a couple times a week and it was otherwise empty, great. But if it's like, okay, you can have Monday and Wednesday and we've got all the other nights, then that's not really an option. But if you've got something in mind, which it sounds like maybe you do, please let me know.
I'll be in touch. Thank you.
Councillor McKenna, and then Councillor McGuire.
Thank you very much, Mr. Chair. And Ramsey, appreciate the presentation tonight. I do want to extend my thanks to your board of directors for taking that leap of faith with us and saying, let's go down this road together. It's good to remind our community that the table has been working in Smiths Falls for at least 5 years. I know, offering some joint programming with other agencies. So you're not new to town. It's the organization has been a partner that has always looked outside of Perth and thought of itself as a regional service provider, and the kind of leadership that you and your board are providing is very much appreciated. One of the things that was missing besides money was the glue that holds it all together. There's a lot of good services being delivered in piecemeal here and there. This is kind of the glue that I've been looking for and others. And I think the leadership provided by the table is very much appreciated, and wish you and others success in seeing this vision through.
Appreciate that. Thank you.
Thank you. I think Councillor McGuire is next.
Thanks, Mr. Chair. Ramsey, I really enjoyed the chance to get to eat with you at the table before the pandemic started, and it was just an amazing experience. It was a weeknight, I don't remember now, but the feeling in the place is unique, because I think it's about friends helping friends. There's no hierarchy, there's no us and them. Everybody was engaged and belonging, and it was awesome. And there was all these opportunities to learn skills. The way the food bank is set up in your basement, I've never seen that before, because in Smith Falls we have a counter. So to go in and have people shop for their groceries the same as they would at the store, it's just it's a really cool way to do it. So I'm really excited to have this all come to town. I think and appreciate all the effort you put in to reach out to us. I'm surprised that there's so few CFCs across Canada. When we look at that map, every time you show us that map, I expect it to be doubled or tripled. But I guess part of providing such a high quality service is that kind of change is slow, and it takes a lot of due diligence to get these up and running. I'm wondering two questions. First is with the faith-based groups. It's great to see that there's lots of involvement on the steering committee, and I'm wondering what the role of those groups will look like once the community food center gets off the ground.
So it's a little bit to be determined. I think, this is an evolving project, but the reason they're on the steering committee is because they're committed to the concept. And so the eventual, I think for sure, at least the weekly meals would probably come to the food hub and be run out of the food hub. In Perth, those sort of really routine, regular kind of food programming has been taken on by the table, but the churches still continue to do monthly suppers on Saturdays when we aren't operating. And because that's part of their community building and part of their outreach, and it's not for us to say, you're not going to do that anymore. But sort of the really regular routine programming where we're, really actually trying to address the food security issues is sort of taken up with the leadership of the table. Now, some of the volunteers we would welcome and to join and maybe quite likely even take a leadership role in some of the meals. So if there would be an opportunity to have somebody transfer what they're doing in one location to the central location if they so choose. So that's the basic idea that we're working under. I just address sort of a couple of your comments, if I could too. So that there are a great many organizations across Canada that are implementing things similar to what we are as a community food center. And that Ottawa study didn't actually involve any specifically branded community food centers, but it involved a lot of organizations doing things in similar ways to us in terms of multiple programs. And the name Community Food Center is a very specific group that's affiliated with one central organization that provides a variety of supports to us and the other sites. And it's also why I haven't been referring to the Smith Falls project as a food center, because it's sort of a specific branded term, and there's some trademark desires around that. And so it gets a bit complicated, which is why we're sort of going with the term hub, just in case anybody was wondering. And because initially, at least, as Nadine mentioned, we're looking at expanding the offerings. And initially, we may not offer all the programs that would be expected of a full food center. And the other thing I wanted to mention too, a couple of folks have mentioned the food bank. Here in Perth, we do operate a food bank. There's no intention of us doing that in Smith Falls. We're happy to collaborate with the Smiths Falls Food Bank and the board of directors if they're interested in learning more about what we do here in Perth. But the plan for the food hub would not be to duplicate that service, but wherever possible, collaborate in sharing food or sharing ideas with them about how we do things in Perth. But we don't envision actually running a food bank at this new facility.
That's good clarification for me. I was kind of copying and pasting one idea to another town, but I'll make sure I use the food hub term. My second question is on the political activism side of it that you mentioned. It's just an interesting idea that I haven't heard in this context before, and I'm wondering what that involves and how that plays out.
Sure. Well, so concretely, what we have is a group that meets a couple times a month. Sometimes more often, they're getting more involved in things, and it's an opportunity for people to learn about local issues and to learn about how they can influence them, to get to know who the key players are, and try and express themselves in a way that hopefully is effective at shifting things. It might be very local. So we've got folks that are very concerned about housing, working with our social justice group here in Perth, and they're looking at, where's the county at in terms of meeting its commitments around community housing. And trying to hold the county accountable for commitments and trying to see where the gaps are. We also will collaborate on national campaigns. So at election times, we've participated with Food Secure Canada on their Eat, Think, Vote campaigns, where we ask candidates about, what is their positions on different elements of food security. And so it's all those kinds of things, both sort of at the big picture and linking in with other campaigns, as well as really local stuff and trying to advocate for change. And it's driven by the participants. So it's whatever issues they're grappling with in their lives that they would like to see action taken on a wider scale, and then sort of come to an agreement and say, hey, this is our focus, and we're going to try and learn about this and then figure out how we can take action on it.
Great. I know the day I visited Perth, I wasn't the only person from Smith Falls there, which I was kind of surprised to see. But so I think it's going to be so great to have this getting going. And thank you to everybody that's been involved. Thank you for coming.
Okay. Thanks for that. I think Mayor Pankow had her hand up, and then Councillor Allen.
Okay. Well, thanks, Ramsey, and thanks to largely our faith-based community, because they initiated meetings going back about 3 years ago now to try to come up with better solutions to meet the food security needs of our community. And Ramsey was invited in and has provided guidance over that term. And obviously, since the pandemic hit, things have changed. The needs have risen, and we've seen our food security partners in the community adapting and doing brown bag lunches and doubling or tripling what they're providing. And it's a challenge. It's a challenge for the dollars, and it's a challenge for the volunteers. And I think there is broader support from the community once we can better define exactly what this is. And I think, Ramsey, you being here tonight will help the community understand a little bit more about what the possibilities are. And obviously, to Councillor Dwyer's point, it's that grassroots support. It's that financial support and those people coming forward saying, I'm willing to volunteer and want to help. I want to be part of the solution, that will ultimately make a difference, because we're extremely grateful that the board of directors of the table have given Ramsey the yellow light to get this far. But I think we also have to demonstrate to Ramsey and to our community and to the table board of directors that our community is behind us, and we'll make sure it's going to be sustainable. And I had an opportunity to read the 2021 Hunger Report from Feed Ontario on the weekend. And 2/3 of the respondents, people who are using a food bank, have less than $100 a month left over after paying rent and utilities. So even after getting an emergency food supply from the food bank, which may last them for a few days or maybe up to a week, they don't have enough to get through. And so the community lunches are vital to meet the nutritional needs. But to Ramsey's point, this goes far beyond just providing food. And that's what makes this opportunity, I think, so exciting. And we know we have seniors, we have families, there's so many people who are living in challenging situations right now. And the number one reason people are visiting a food bank now, or seeking food, or are food insecure, is the cost of housing. And that was only 5% of respondents in 2020, it was 32% in 2021. And we see that in our own community where the people's budgets, any discretionary income they had is virtually gone or is gone because of the rising cost of housing. So this is an incredible opportunity. I think our community, to Councillor Alford's point, will respond. We'll be there. And I think Ramsey's working on, and maybe Ramsey can comment on that, on mechanisms that you can utilize to help gauge community support. They'll be seeking pledges and money, but also seeking volunteers. So my only question relates to that, please.
Sure. So in the weeks ahead, we'll be launching our communication strategy, and big part of that will be giving people an opportunity to say, yes, I want to be part of this. We might not be able to quite ready to take people's individual contributions, but we'll be asking people to make a commitment and to pledge support either to the capital costs as we define those a bit more, or to an ongoing support for the programs, or to volunteer, or all of the above. And so both individuals and businesses, in order for us to really go from yellow to green light, we'll need sort of that sense of confidence that, and I have very few doubts that this is going to go forward. I'm very, very confident in the town of Smiths Falls that they're going to get behind this. Every time I talk about it, people say, yeah, that's a great idea. Let's do this. And so it's really just a question of documenting it and giving the board of directors here the confidence that yes, this will be successful. And so, yeah, stay tuned for some social media posts and conventional media information about how to log on and just sort of say, yeah, I'm behind this, and I want to, I can offer $10 a month, or I can volunteer once a week, or I can do, X, Y, or Z. So we'll be sending that out. It'll be just a simple form people can go to online, and we'll have paper copies available that people can do that. We'll just demonstrate, and then we'll collect your contact information. So when we get the green light and when we're moving forward, we can back in touch. Say, remember that thing you said you would do? Now's the time.
Great. Thanks again, Ramsey.
Okay. And finally, Councillor Allen.
Yeah, I mean, I don't know what's left to say. I agree with my colleagues, and I welcome the idea of a Smiths Falls Food Hub project here, Ramsey. I'm very familiar with what you do in Perth, and I think it would be wonderful to have the same opportunity here. I also know that there's a great need. Christopher Ryan is my minister, and our church has been very actively involved in providing food. And what we discovered, that I'm sure you know this as well, is it provided more than food. It provided interaction of people who wouldn't otherwise have met, or who wouldn't have had those kind of social connections. And the social connections with food, I think, is one of the most important parts to it. Especially in in families that are single parents, or that are just struggling to have other people in their lives. Many years ago at Elgin School, a group of us teachers that were there started a breakfast program for the same reason. The children we knew couldn't stay awake. They weren't interested in school because they were hungry, and they were arriving to school hungry. And I know that breakfast program is still running for the same reason. So food security is not going to go away. What we need to do is address it and try and figure out the best thing we can do for our town. So thank you very much. I'm in full support of helping and getting that project underway. And I look forward to how it's going to evolve in Smiths Falls. Thanks, Ramsey.
Thank you for that. And thank you, Ramsey. I think you've got a pretty good indication here of what's going to happen next week, but we'll be talking about that next Monday. And thank you so much for coming and for the work you do.
It's an honor, and I really thank you for your support. I'll be sure to pass on the very encouraging words that you all shared with me with my board of directors here in Perth.
Okay, thank you. Okay, finally, last but not least, Tony Humphrey from the Railroad Museum of Eastern Ontario with their presentation on a 2022 municipal grant request. The floor is yours, Tony.
Thank you, Chair and Council. Yeah, thank you very much. Nadine and I are putting the presentation together. I can't go. Could you move it up a bit for me, Nadine, please? Oh, yeah, thank you very much. Okay. Everybody's familiar with the museum that I know. Back to 2019, we had 11,000 visitors at the museum. Since 2014, the attendance has been increasing by about 20% a year, right up until 2019. Our premier events, of course, have been Train Fest, the North Pole Express, which we did again in 2021. We had scheduled it for 4 weekends, but because of the latest outbreak, we had to curtail the last one. We didn't do too bad, but it wasn't pre-pandemic. On that, in our planning for this year, we have more events planned. I'll get to them later. The overnight in the caboose, 2021 did very well again. We'd had 96 overnight visitors, most of them from actually from other areas of Canada. We would have had more. The problem was that we could not, couldn't hire enough staff to do them, to maintain them. We had to close two days a week in 2021. Hopefully, with our students this year, we'll be able to do a little bit better, and of course with staffing. Can we go on to the next one, please, Nadine? Thank you. Strategic planning. Thank you very much, Council, for your support in this. We're looking very forward to getting this underway. It's going to be, hopefully we can get that underway early in January. We're expanding our events, like our anchor events, that is. The dining car, we want to do a supper club series in it with chefs from around the area. The very successful Harry Potter event that we did in 2019, we want to piggyback on that for sure. That had our biggest one-day event attendance. We had 1,860 people attend that for that one event one day. And there was probably about 200 people who just walked in. We've since rectified that situation. Anybody who's been by the museum, you'll see we have the parking lot is now completely fenced. Something else we want to do this year as well is we're planning to do a Halloween event. Another thing I wanted to touch on, something about I felt we've been missing. Since most of our equipment is pre-mid 20th century, some of it is back in the 19th century, it's very restrictive. Anybody who is trying to access it, who is handicapped. The museum itself is handicap accessible. One of the things we're doing this year, Gilbert and I, we have a carriage on rails and in the lot that we are doing over so we can load and unload handicapped people on it and take them for train rides. So we're looking forward to have that going in for this season. The Airbnb, every event, I'm bragging here, every event that we put on Eventbrite, we're sold out before. The Santa Claus before Christmas, every event was sold out. We were running on a 20-minute schedule, which was very aggressive, but we were getting behind towards the end of the day, but we were sold out for the whole day. The grounds, I've already been talking with Julia about the possibility of having a walking trail through the property. As we're all from Smith Falls, we all know that William Street there's no sidewalk facility on that. So we would like to see a walking trail go through our property. One, for community involvement, for health, of course. The other one would be, I've always recognized the north side of the property between, actually it is our property, is is in dire need of a good cleanup. We want to, yeah, there's a lot of things we'd like to do there. Okay, the events, I said the Premier Chef event, we're looking forward to implementing that this season. And as you know, our museum was the site of the first full-length motion picture shot in Smith Falls. We have done 3 movies to date, and I don't have to tell you the spin-off to the community. The second last one, they also rented 2 off-site from the museum. I believe one on Main Street and one on Maple Street. So it's a great spin-off for the local businesses. Like when we're doing the movies, we have also done 2 TVO shoots on site, but they don't pay, where the movie shoots certainly do. We're also looking into the wedding business, et cetera, as well. Okay, part of the show, oh yeah, I gotta mention that one. The National Tulip Festival, we were approached about this back in actually 2019. It was supposed to take part in 2020, but of course it was put over. We will be promoting the museum in Smith Falls in Ottawa during the National Capital Tulip Festival this year. In fact, if you go on their website, you'll see the museum is actually listed on it. And as the administrators of the Tulip Festival said, that they get about 2 to 3 million people who come to it. So it's going to be a big promotion for us and for Smith Falls. You see the other ones we do. We want to get into more the school education programs as well. As I mentioned before, the accessible tours, the walking tours. Airbnb has been a great promotion for us for the overnight in the caboose. We're limited. The only thing what is limiting us is, of course, been COVID. We can only rent out 2 cabooses at a time. By the time this pandemic ends, we hope to have 4 cabooses ready to go to be rented out, which is going to vastly increase our income from this source, and also goes towards our diversification as well. The event expansion, we're aggressively pursuing it. Grant writing, we have actually hired somebody to write try that again, Tony, write grants for us. And anyway, the last slide. Oh yeah, look at that guy. Great picture. You see, what I'm seeing when I'm looking at this is the rust around the front of the engine. And there's something I wanted to touch on, other than the great photograph there, is the volunteer base that we have accumulated in Smith Falls. Some very, very good professionals who are retired and about to retire. We have a group of them coming from Ottawa right now who are working on actively rehabilitating this engine. So when it comes back out front, it's eventually going to look like it's in showroom condition. And anyway, thank you for your support in the past. I'm looking forward to some more in the future. We can get through this pandemic. And of course, the way we see it is supporting the museum to us is the same as supporting Smith Falls.
Thank you, Tony. Great information. Councilor McGuire's got his hand up first.
Thanks, Tony. Great presentation tonight. You always bring new pictures that are great representations of the town. And it's exciting to see, even in COVID, how much you've been able to do and how much is on the table coming down the tracks. I think, I hope this is the only time you have to come to us this year. And I was wondering about the roof. It's got a lot of patches in it. It's in need of repair. Is there a plan for that? in the short-term future, or what's the strategy there?
Well, I don't want to let you in too much of our strategy. When Gilbert and I go up on the roof to patch it, we use different color shingles. That's part of my strategy. I want people to notice that, yeah, we do need a new roof. The main thing is the roof is not like it used to be. The roof does not leak. We're looking at long dollars to do it, and we're hoping our grant writer can come up with a grant to facilitate that. What needs to be done, Chris, the shingles all need to come off. Now shingles have been hammered on that roof now for the last 110 years. So the boards underneath are completely saturated with nail holes. So what needs to be done is like 7/16 plywood put on the roof, then shingled over the top of it. It's a long job and it's an expensive job. But the thing right now, the roof is not leaking. I just have to go up and help Gilbert when my wife is at work and she doesn't see me.
What kind of ballpark is that job, Tony?
An estimate on that would probably be between $85,000 and $100,000.
Thank you.
Thanks for that. Any other questions, comments? Tony, I want to thank you for all your work. The presentation today was impressive. The potential is huge. And I look forward to this coming forward next week. So thanks for coming.
Thank you. Thanks, everybody.
Okay. Okay. We have no adoption of minutes tonight. My understanding is we have 3 directors' reports. And I believe the first director's report would be Director Manhire. Hello, Director Manhire.
Hello, Mr. Chair. Thank you very much. I just have a few things this evening. The CDC is operating targeted emergency childcare again. So this is, as a reminder, just the childcare that supports essential workers in their work. So we have been asked by the county through the province to operate that and have some capacity. So we've been approved for 13 kinder spaces and 15 school age. Registration is being done and eligibility is being done through the county. So anybody who is in need of that care should get in touch with the county for registration. Today was the first day of operation for that service. That service, by the way, is fully covered by the province in terms of our expenditures for the program. We also have the tender open for the town hall phase 3. Today was our on-site meeting. We had 24 companies come through to do the mandatory on-site visit. So we're very pleased with the interest in the project. We will be responding to questions from those contractors in the coming days. And then it closes on the 20th. And our opening is scheduled right now for the 21st of January, sorry. So we will be looking at bringing that forward shortly thereafter once we've reviewed and selected a bidder. The arena and senior center is closed as per the provincial order, but the vaccination clinic remains open. The outdoor rink is open and will remain so as long as the weather permits, and we can do that. The OREG is just out now, so we are reviewing that with public health just to confirm what can and can't be done on that surface. And we will be informing council and the public as we proceed through that process. Staff at the community center have done 645 QR code passes for people with their vaccination certificates. So that is not happening at this point because the facilities are closed, but people can still have that service done either and I believe that it can be done at impression printing or at the library if people do not have a printer at their own homes. As we have understood it, the QR code that is represented on somebody's passport is valid even when you get your booster shot, because it connects you directly to the provincial database. And so there's not a need if somebody gets their booster to reprint their document. We've had a significant number of people do that, but the QR code will still read through to show your full vaccination status. And I just wanted to confirm as well that we had a discussion earlier about the table, the Festival of Lights that happened over the holidays down in Centennial Park was a big success. We got a lot of good feedback from it. Just as an information piece, we do request or solicit community sponsorships and company sponsorships for the trees that we have down in the park. Those trees are decorated and the sponsors recognize that the sponsorship dollars that come from that will be turned around and actually donated to the food table this year. So we're just getting all those donations in, and we will turn around and then have a check that council can present to the table. As well, the trees that are there that are decorated are donated through some of the community services to families in need through the community, and those were donated the week before Christmas so that families could have trees, and we also purchased decorations for them as well. So all in all, I think it was a fairly successful event, and look forward to doing that again, and thank the sponsors that stepped forward to help us out with this. It's 17 corporate sponsors. We anticipate having somewhere around $2,500 that can be donated.
Awesome. Councillor Dwyer has her hand up.
Thank you, Mr. Chair. Just a quick follow-up. I want to give, I know Mayor Pankow has already mentioned this on social media as well, but I want to give a huge thank you to Mr. Kevin Grimes and Mr. Rob Garbin, who worked tirelessly last week to make sure that that outdoor rink got flooded. I took my kids there this weekend. It was very, very popular. There were about 18 or 20 people on the rink, all social distancing very nicely because there was lots of space to be out there, and a huge thank you. I know Parks and Rec staff have been out there monitoring to make sure that people are following the rules because they did come over to say hi. But it's such an asset for the community, especially with the indoor rinks closed, that it's just really, really nice to see that that we've got that asset in the community. So thank you.
Thanks for that. Councillor Alford, do you have your hand up? Did I miss that? Nope. Okay. Thanks, Director Manhire, and thanks for everything. It's been tough, and I think that you guys, especially doing the QR codes, has been great, and getting that rink open was really special. So the next one I understand is Chief Cheeseborough.
Thank you, Mr. Chair. A brief update on a special meeting for the emergency control group that we held last Monday, pending the announcement on January 5th of the government. To report, Lanark Leeds Grenville currently has 1,424 cases as of last Monday. As of today, it has increased to 1,698. With 12 in hospital last week is now 18. Still 5 people remain in the ICU. KFLNA last week had 2,214 confirmed cases. They have since seen a significant decrease. As of today, they're down to 745. Ontario reported over the 3-day weekend 48,737 cases. Canada at that time had 2.3 million cases. We've increased just shy of 2.6 million. Kim McCann was present from the health unit and provided an update regarding the provincial announcement that was pending. The new regulations, which encourage those who feel sick to stay at home and self-monitor for symptoms and use the rapid test kits only if the symptoms are present at home. Standard lab testing is being reserved for those who test positive with the rapid kits or at work or working in high-risk jobs. Isolation measures have been changed from 10 days to 5 days from when the symptoms are present. And if you are vaccinated, if you're unvaccinated, it remains at a 10-day isolation period. It is now the responsibility of individuals to notify others who have been in close proximity if symptoms and positive tests have occurred. It is no longer the health unit that will be doing the contact tracing. Employers are solely responsible for managing employee cases within the workplace. Vaccination clinics will continue to run at full force, focusing on those age 50 and over. Management has implemented a new employee self-screening and monitoring policy. Employees are reminded to self-screen before coming to work and sign the acknowledgement sheet in the work area upon arrival. The new provincial restrictions for municipal facilities, as previously mentioned, the community center, the arena has been closed, the Heritage House is closed, and the youth center as well as town hall. The community service last week, we were planning on assessing the outdoor rink. As stated, that is open. And just to say a big thank you to firefighter Bizinet as well for going over there on a daily basis. Yesterday, this morning, and he'll be going over again tonight to do more flooding of the rink. I have sent off a request to our provincial emergency management field officer for clarification on the restrictions for the outdoor rinks. At this time, she was only able to provide what Ottawa is currently doing and indicated that they have that monitored for 25 people on the rink at any one time. So once we have the final say from emergency management, we'll be able to put that into the general public. Some of the items that were included in last week's announcement was the closing of the facilities and gyms. Weddings, funerals, and religious ceremonies have been reduced to 50% capacity. Theaters and museums are closed. Schools closed for 2 weeks up until the 17th. Retail settings have been capped at 50%. Personal care reduced to 50% capacity. Indoor gatherings and indoor organized events are now limited to 5 people. Outdoor gatherings restricted to 10. Libraries have been reduced to 50% capacity. And the last item is the state of emergency will continue to remain in place and we'll continue to reassess it. That is my update, Mr. Chairman.
Thank you, Chief. Questions for Chief Cheeseborough? Councillor McKenna?
Thank you, Mr. Chair, and thanks for the update, Chief. I guess it's more, I know people are very frustrated and concerned with I guess felt we were coming out of things in the fall and we're back into this deep, serious time. I do encourage people to keep the faith, keep their head up, keep trudging forward. We will get through this. And if you want inspiration, I go to Lake 88 every Wednesday. Dr. Paula Stewart has the facts, has the most recent information. She answers your questions. She remains positive. She is my guiding light. She gives me hope when I feel discouraged. I'm not finding that information in unvalidated sources on the internet. I go to Dr. Stewart or other doctors and nurses, and she gives me hope and inspiration, and we will get through this together. So if you feel like you're low, please listen to her. She's upbeat, positive, and has the facts. And together, I think, with the leadership from the town and the chief, we'll get through this together.
Thank you. Through the chair, thank you, Councillor McKenna. And I just wanted to follow up on that. Certainly, Council, we certainly appreciate Council support through this process. It's been some very difficult decisions that have had to be made. And Dr. Stewart has been an unbelievable resource for our emergency control group. And I can certainly speak on behalf of the control group is that the stress and strain has been truly felt by the group in making decisions. We fielded a number of questions and concerns, but the control group, certainly through our chair, CAO Morris, we've been able to navigate this process and hopefully provide the most up-to-date current information that's available to us. And we do rely on the health unit and guidelines from the government. So thank you for those comments.
Yeah. Well said. I think that the control group has Council's full support in the decisions you've made so thus far and going forward. And I think that there are brighter days ahead. So thanks for that report.
Thank you.
Okay, finally, I believe we have our Economic Development Director, Julia Crowder, on the line. Hi, Julia.
Hi, thanks. So I just have a few updates for you. The first one is to acknowledge and congratulate staff and volunteers at the board at Heritage House Museum. They were recently nominated for a 2020 Ottawa Faces Magazine Award for Best Museum, and that's under the Leisure and Tourism category. So they were one or the only museum outside of Ottawa that was nominated. Nominations and awards are really community driven. So there's the opportunity for users and residents to vote for the museum to win the award. And we're looking at doing a social media campaign to encourage residents and visitors of the museum to vote. The voting is open until the end of January. So that's really exciting. So congratulations to Heritage House on that. The other one is just to update quick on the Marion Bright program. That was a shop local initiative for retail and businesses. This year is really successful again. This is the second year that we launched it, and we're working with businesses to identify a number of boxes that were sold and to gauge the revenues that were produced. As well, with the recent lockdowns, we know our restaurants have been significantly impacted. So we're working on a modified picnic program to support our restaurants. We're going to launch that hopefully on the 21st of January. Similar to the picnic program, restaurants can curate a meal, and we will look to market and provide them with kits in order to do that. And that program will run until the current lockdown measures or the closures for restaurants end or until the restaurants decide it's no longer needed. We're also supporting the chamber in partnership with the DVA for a potential outside dining experience. So the chamber is working on that, and staff here in economic development and the DVA are looking to help run that with them. And that's my update.
Thank you. Questions from colleagues, comments? Oh, great news on the Heritage House, and really proud of them. And I'll have a report actually to council. They sent out a New Year thing the other day, so about numbers and what they've been up to. So excellent report. Thank you. All right, we have no correspondence items, no in-camera items. We have one priority issue item that we all want to hear about, and that's with our senior planner, Mr. Grenke.
Thank you. Good evening, Mr. Chair. This evening, I'm presenting a recommendation from the Community Improvement Plan Evaluation Committee regarding an application under programs 4 and 5 for 7 Maple Street. That property currently is vacant, however, contained a medical office building that was recently demolished in order to accommodate the construction of a 4-story mixed use at the corner of Maple and William. On November 29th, Council gave site plan approval for the development, enshrining various engineering, servicing, design, landscaping, and streetscaping elements to accommodate a development that checks a lot of boxes that our planning documents look for in the downtown core. The CIP support they're seeking for is a 50% rebate on the cost of undertaking a phase 2 environmental site assessment for the property, up to an eligible amount of $2,550, representing half the cost based on the lowest quote provided. The program for tax abatement can be valued up to 100% of the residential increment for a period of up to 10 years and 80% for the commercial. While the developer had envisioned seeking CIP support to facilitate this development, unfortunately, the Program 4 application was not actually submitted and received by the town until November, just before site plan approval was given. That being said, the developer's application cited several site planning aspects of the development, including burying the power lines to enhance the streetscape, pedestrian enhancements, landscaping, and design as significant costs that add value to the project and that support his request. And he had advised this was something that the application he was planning on filing that for some time, and there's a number of reasons there. As development had not yet started, the proposal does remain eligible. Additionally, the estimated project value suggests that it would exceed the minimum threshold to be eligible under Program 4. On December 15th, the CIP committee considered the application under both programs and passed a resolution in support of Program 4, with the resolution for the smaller Program 5 being supported by the committee only if Program 4 is not. Similar to the last approvals under this program, the committee did not recommend conditions with respect to duration and/or extent of the tax abatement, so as to ensure flexibility when final funding is discussed by council following impact reassessment. While the site plan conditions are essentially locked in through the approval, the report does note a few options for council's consideration. As council is aware, the building code outlines barrier-free requirements to and through 15% of units in a multi-residential development. However, in the opinion of the Housing Advisory Committee, that does not go far enough to meaningfully provide for accessibility. In discussion with staff, the developers have advised that they are looking to accommodate entry enhancements and unit improvements above and beyond code requirements, and they're open to enshrining this in a funding agreement if council requires it. Likewise, they are open to considering making 2 of the 1-bedroom units more affordable if required by council in a contribution agreement. Ultimately, staff and the committee recognize that the approval in principle is subject to any conditions deemed advisable by council. Ultimately, the committee and staff support the principle of this development and recognize the proposal represents a very substantial improvement of a large property in the edge of the downtown that has not been substantially used in recent years. Section 4.2 of the CIP identifies the shoulder area of downtown as the ideal location for multi-residential development, which add vibrancy to the downtown core. As such, this recommendation is brought forward on behalf of the committee, but I'd also like to acknowledge the work of the committee and planning clerk Mary Remig for the significant attention they all pay to these applications and evaluating all aspects of the proposal. As always, with a project such as this, there's been a lot of work behind the scenes, and I'd like to appreciate their work in taking this up. And I will look for council's direction on the CIP committee's recommendation. Thank you.
Yeah, thank you, Carl. I'll just, as a aside here, I think we're at 6:45. I believe His Worship and CO Morris must leave us at 7. So maybe Your Worship might want to chime in sooner rather than later if you want.
Sure, that's great. Thank you, Mr. Chair. Yeah, great presentation, Carl, and thanks to you and Mary, CIP committee, for the work that's been done to get this to council, and for the developer in working in getting it this far. When I look at this, I think it's a great example of probably what the council at the time, back it's including Councillor Brennan Allen and I, in 2013, the CIP was created. We would have regarded the old medical center as one of these probably key properties that really needed redevelopment, and not that we expected to happen maybe in the way it has in the time frame it's happened, but I think this is a great example of what we would have probably hoped or dreamed for. It really just checks off all the boxes, and I guess we built a CIP specifically to try and help redevelop the downtown, and this fits perfectly within that. So while I don't believe it's appropriate to negotiate benefits in exchange for the abatement, I'm encouraged to know that the developer is willing to, based on the recommendations of the Housing Advisory Committee, make the required units, which I assume be 4 or 5, accessible units, universally accessible. In other words, meeting the needs for functionality, people who have limited mobility. And so that's a big step forward. It's very positive. So I would like to see that ingrained in a development agreement. And the other piece, which you made reference to, Carl, being some affordable units. And I think my memory serves me right, it was suggested the developer were willing to provide 2. Well, I'd love to see more than that. I think we're in a position here where, I mean, it meets the standards we would like to see. And I think an offer from the developer to do this, to provide some affordable units is very welcomed. I would accept the 2, but I'd love to see more. And of the 2, I think it'd be appropriate that potentially they be the universally accessible built units. understanding that quite often people who have limited mobility may be living on a fixed income, and that much more important for them to have a unit which is more affordable for them. So that's the limit of my comments. I will leave it to the committee to wrap this up, and I will be here for a moment to listen in, but as mentioned, we'll have to leave as we have a delegation in Miracle Wolford. Thank you.
Thanks for that. Councilor McGuire.
Thanks, Mr. Chair. Thanks a lot, Carl. Happy New Year. It's a good report to start us off on. I think this project is really one of the best examples of the CIP at work. We got a site plan a few weeks ago that checks all the boxes, and I think that the developers really had a chance to has really made the effort to dig into the CIP and create a development that is the kind of thing that we want to see in the downtown. I think best practices going forward is definitely to have this conversation before site plan control so we can iron it out. I think that on the same tier as what the mayor's saying, and going back to the other program 4 application that we dealt with, I think it's the best practice to get everything in writing, very clear, before we agree in principle, because very likely that there'll be a new council that will make the final funding decision when we look at occupancy dates and when that impact reassessment is going to come. And I think it's going to be critical that for the developer, especially that there's a clear understanding and a clear context set now of how much these extras really cost, and acknowledging that they add a lot, they will add a lot to our downtown. So things that kind of come off the top of my head would be, the mayor brought up with accessibility and affordability. They've also got they're putting the hydro line underground there, which is really important for that corner because it allows them to put the building on the corner and create that downtown look right up to the corner instead of having a big parking lot that feels like you're walking by just a bunch of cars. So there's a lot of cost that comes with that, but it's not captured in the motion the way it's presented. I think with the green space and landscaping, just having these things down on paper, it saves some of those back and forth that we got into with the last program 4 application. The lighting and signage is awesome, and it's just let's document that. And there's a really cool feature that the builder was telling me about the other day, that this is actually going to be a zero emissions building where it's going to be heated with heat pumps, and it's not going to have a natural gas hookup. So that's really cool too. So I think it's just a matter of documenting this as a really good news story, and then when it comes up for the next council, there'll be a really good case for putting some numbers down when we actually have an impact assessment and can make a firm commitment. For the ESA side of it, I fully support the 22,550. And I would support taking the remaining 3,000 and putting it into the surplus for 2021.
Thank you. Any other comments? I can chime in. Oh no, Nikki, go ahead.
Sorry, I'll just be really quick. I think this is the first application that the CIP has received that takes advantage of the brownfield offsetting costs for studies. That's huge. And I'm hoping if the press picks up nothing else, it's that there is funding available for brownfield redevelopment. And there are several sites within this area that sit vacant because of contamination. So the final figure there, I missed it, Chris, $22,000 is being rebated.
It's just 2,500, I think. It's not that
2,500. My apologies. 2,500. That's still a significant chunk, even to get your phase 1 and phase 2 done, let alone remediation costs. I mean, the programs there, the more that people know about it, the more likely there is that we'll see redevelopment on some of those vacant and underutilized sites. So this is a good news story. Hopefully people start to recognize that the funding's there and can take advantage of it. Thank you.
Thank you. Okay, Lorraine, go ahead.
No, I'm not going to say much other than I live on Maple Street and I've gone by that building site for many years, hoping that someone would come around it and look at it and see some potential and do something really I had no idea that it would be this grand, but I'm very much in favor of this building and I can't wait to see it go up. I was at the gym at the time in that building years ago when it was contaminated and that was closed. And all of us were so upset at that time because it was a great facility, but the building just wasn't able to support it. Anyway, good news story. I'm very much in support of this and look forward to it being built. Thank you.
Councillor Alford.
Thanks, Mr. Chair. I am very excited about this building for several reasons. And I am supportive of the $2,550 for the environmental assessment. I'm not, this is only our second one when talking about the tax abatement. And I'm not just comfortable yet with how we're arriving at what that will be and what that will mean in the long term for the municipality. So I'm really supportive of this development. I'm really supportive of the 2,550. I'm a little uncomfortable still with how we're going to arrive, as this is our second one, what this exactly means for our municipality now and in the future when we do this. I watched the meetings. There are still some policy gaps in how many quotes you have to have, what you have to do. I'm still not completely comfortable with the program and what we expect from developers and what developers expect from us. So I don't know that I'm ready to, and again, this is a long report and I've watched the minutes, I've watched the meetings and I've watched the minutes. So I don't want to commit to anything tonight regarding tax abatement. I think that needs more work.
Okay, I'll just chime in there. I don't disagree with you. A couple of points. One is I think that these two programs should be evaluated independently, i.e. don't make a condition, we'll give you this if you do that. They should be evaluated independently. The other part, especially on the tax abatement piece, is I think that there's absolutely need to acknowledge that this developer went above and beyond, i.e. burying the hydro lines, making an absolutely beautiful design, which has been approved on site plan. But, to ask for 100%, I would need to have some sort of, how do you quantify that? Like, how is that just picking a number out of the air? We don't have the impact assessment to evaluate it, but what is the, you've got to be able to quantify all those value added that they put into, which I absolutely need to be acknowledged. But I think that, with this report, what we're talking about is to support in principle that acknowledgement needs to happen. And then there'll be a discussion down the line when we get the impact numbers, and then we can get some sort of a idea of, what these value added really mean and what they're worth. It's not like, well, they're just going to say 100%. Well, maybe, but I need to, I would need to see how you arrive at that. So I'm happy to support this report in principle, and then the discussion will come about, okay, so you've made an absolutely beautiful building in our downtown. And so what is that actually worth? It's not like 100, is it? If it is, then it is, but I'm happy to support what's proposed here. And everybody's got their hands up. Wendy.
Thanks, Mr. Chair. And I don't want to leave anybody with the wrong impression. I am in favor of tax abatement programs, for developers who invest like the two that we've discussed so far. I'm just not completely comfortable with the process and what that means, because without impact, without knowing what's going to happen, what are we committing to? Will I support in principle tax abatement? Yes, but I don't know what that means yet.
Councillor McGuire, and then I'm going to call on CEO Morris to enlighten us here.
Thanks, Mr. Chair. So I think the difficulty is, and I agree with everything you said, Councillor Brennan, it's just the timing of it. I think with the last program 4 application, we're running into a lot of difficulties coming up with a number because the municipality didn't set a clear list of expectations going into the agreement in principle. And we've got a CIP meeting coming up this Wednesday where we're trying to hash this out, and it's really more difficult than I think it needs to be. I think with that hindsight, I think it's prudent to set the expectations with the developer now, say, we really appreciate that you've incorporated A to Z into this design, and it means a lot to us, and it's going to really mean a lot to the municipality. And then there's that context for having that conversation in a year when it's got its occupancy and people are living there, and we've got a beautiful building in the downtown. And this is why, as much as I support it, I had to vote against it at the committee level because the committee wasn't willing to go into that level of detail. And I think it's really important for council to set the expectations now, or we're going to be putting a very difficult conversation into the first couple months of a new council in 2022, 2023. So,
well, thanks for that. That's why they make the big bucks, to make decisions. CEO Morris, can you chime in here if you could?
Yeah, certainly, Mr. Chair. So I think what's important is the decision in front of you tonight is an in-principle decision. So you're not committing to any dollar amount at all. The program has maximums, both in terms of the number of years the abatement could carry on and the percentage of the assessment increase that will be covered. So really, you're not committing to anything. I do agree that more clarity at this point in the process would be advantageous. I would remind committee that we have a RFP out to review the CIP program, and that will be an opportunity to perhaps put some more definition around this program. But and the other thing I would add is that we have reached out, or we will be reaching out to MPAC on this file. They used to provide forecasts of future assessed values as a part of the service they provide. They now do that on a fee for service basis, so you should be aware of that. We're not sure what the fee is, but we'll get that information. So we can, working with MPAC, we can reasonably predict what the value would be, and we can run scenarios so you'll understand what the ceiling and the floor is, so to speak, in terms of abatement assistance. But I just want to reiterate, you're not committing to a dollar figure at all this evening.
Yeah. Thanks for that clarity. Councillor McGuire?
So CEO Morris, just are you recommending that we get more clarity on the expectation, or I'm not sure on that, just when we don't know, we don't have the elevations, we don't have the accessibility, we don't have the affordability. All of this stuff is just fairly vague at the site plan level.
Yeah, so I think if the desire is to pursue more affordable units, then clearly we'd need to know that first to see if the developer is willing to go down that road. So that would be, if that's a concern or a priority for this council, then I would say defer the decision, the in-principle decision tonight, until we get that information from the developer. I think, we have a very flexible and broad thinking developer here. I think we all agree it's a phenomenal development. I would just caution committee against going too far beyond the parameters of the policy when you're asking for extras. Many of these things can be done at site plan, but if there's a desire to look at more affordable units, then that's the direction staff needs to go and have that conversation. So if that's the priority, to boil this down, if a committee believes it's important to at least explore more affordable units, then I would defer this decision this evening. If you're happy with the level of accessibility or affordability, then I would suggest you approve it this evening in principle.
Councillor McKenna, hand up.
So I think the developers have put forward the idea of 2 units. They feel that that's something they can afford to do and run the project. And so I'll take them at their word for that. And so I'm ready to proceed in principle with the information I have tonight.
Thank you. I am too, and I really wonder the appropriateness, I don't know what the word is, of council trying to leverage more units at this point when the site plan has already occurred. But I'm ready to approve in principle. Anybody else? Nikki?
Yeah, I'll support it in principle as well.
Me too.
Okay, so Wendy, just yes or thumbs up for everybody? Okay. So I think you have your direction, and that will, does that need to come to council next week? Yes. It'll come to
Yes.
council next week?
Yeah, yes,
Okay.
it will.
Okay, thank you.
Mr. Chair, I have to dash off to another meeting.
Okay,
but,
yeah,
Thank you.
for staying for that. Thank you. Yep. We're at the end. So I'll entertain this motion that the committee adjourn its proceedings at 7:07 and stand so adjourned until the next duly called committee meeting. Moved by Councillor Alford, second by Councillor Dwyer, all in favor. Good evening.
Great.